So when we think about funding and claiming, there's a hierarchy of who's ultimately responsible for paying for medical services. At the very top, you have special cases. So people that are in the Defense Department, people that are part of firefighter, police unions are funded out of a very special pool, and they're always paid for fully. There's also things like workers' insurance. So if you're here for work, like everyone from Cliniko, you get hurt on the job, Medicare won't pay for it. It'll actually be WorkSafe Victoria. If on the way home, unfortunately, you get in an accident, Medicare won't pay for that either. It'll actually be TAC, and there's similar bodies in other states. They have corporate, community health, NDIS and aged care are growing groups. So NDIS is the National Disability Insurance Scheme, and that's going to be about 20 billion in spend, and that's about the same size as all private health insurance combined in Australia. The one we'll talk about here is Medicare, which really comes into place for, you'll see, a significant number. So in 2008, in Medicare, just for allied health, there was about 15.8 million claims lodged, and there was about 1.6 billion in benefits paid by Medicare, either to healthcare providers or to patients. And if we looked at the top claiming professions, there's a few of them. Sorry, the text is a bit small. Psychologists were actually number one at 5.2 million claims, followed by podiatrists at about 3.2 million. Aboriginal and Torres Strait Islander health represented about 2.55. Physiotherapists at about 2.5 million claims, so it's significant. If you broke that down by demographics, and I actually just pulled out one of them, and this is for physio services. So for a particular set of physio services, the most popular program, which we'll get to next, chronic disease management, it's about 10,700 services per 100,000 people in Australia. It obviously tends to be more staggered towards an older demographic. That's for physio. If you looked at other services like psychology, you'd see a slant going the other way, and actually a significant number of people under 30 receiving services. It's a lot more than what people expect. There's a few different funding schemes that actually sit behind Medicare. So Medicare is really the overall organization, but there's different schemes that are legislated by the Australian government that actually dictate what services are going to be paid and how many services will be taken care of out of it. The most popular program is something called chronic disease management. And a lot of people might have heard of that in the past as enhanced primary care. It's replaced that program, and it covers a range of different professions, which we'll go through next. The second largest service is Focused Psychological Strategies, FPS. This is better advertised as the Better Access Initiative. So this covers a range of different things like eating disorders, mental health plans prepared by GPs and other specialists. There's pregnancy support counseling, allied health services for people with type 2 diabetes, and that really gets into education and exercise physiologists. And then allied health services for people living in descent from Aboriginal and Torres Strait Islanders. And the last program on here is a large one that's now being merged with NDIS, and that's children with autism pervasive development. It used to be known as the Better Start program. This next one's going to be a little bit dense, so hang with me. This is scheme claiming, and depending on the range of provider that you have, there's different rules around which programs that you can access and how many claims that you can lodge per calendar year. This is an interesting thing. Medicare takes a look at everything per calendar year. So if you have a referral in December, the number of sessions on there are actually only good until the end of that calendar month. You have to get a new one for the next year. But if we looked at things like chronic disease management, it supports allied healthcare providers that are in one of the different professions. So you have Aboriginal and Torres Strait Islander health, Aboriginal health workers, audiologists, chiropractors, diabetes educators, dietitians, exercise physiologists, mental health workers, including social workers, occupational therapists, osteopaths, physiotherapists, podiatrists, psychologists, including clinical psychologists, and speech pathologists. And with that program, you get 5 sessions a year that are covered by Medicare. To give an indication of what they pay for it is on a standard physiotherapy service, they'll rebate about $53 per session. You get 5 of them. Some of the other programs are a bit more generous in the number of sessions that you have per year. So things like focused mental health strategies, particularly for those that are under 30 with eating disorders, you get 20 sessions a year, and that's actually rebated at a much higher rate, between $120 and $160 per session. And one of the changes that's been had here is that telehealth services are now permitted for 7 out of every 10 sessions. And that really came about after people living in regional remote areas of Australia were unable to access the providers who specialized in their particular need. One of the other programs that's probably not as well known is Aboriginal and Torres Strait Health, and there's about $600 million spent in services for people within those communities. And the last one, this actually surprised me because most allied healthcare providers aren't familiar with it, is the PDE program, or Better Access Initiative. My daughter is actually part of that program, and it gives you 20 sessions a year, and instead of the smaller rebate at about $53 a session as a physiotherapist, it rebates at $74, recognizing that people with these type of conditions need access to those perhaps with more specialization. So what do you need to do to raise a claim? So it's a few different things. You have to be an eligible allied healthcare provider, and you have to deliver the service. So you have to be registered with Medicare Australia to do it, and you have to be in one of those recognized professions. You have to bill using the correct MBS items. So MBS is Medicare Benefit Scheme. You have to abide by the rules in there. The patient has to be eligible. A Medicare practitioner must refer the patient. So a Medicare practitioner is usually a GP, but it can be a specialist. And for things like the PDE program, it can actually be other psychologists that refer you into the program. And the last thing is that you need to, as a provider, give reports back to the referring medical provider to the first session and the last one. And that's essentially it. You need to keep those records for about 2 years in order to be compliant. So a couple of different things on benefit options. There's 2 main ways that you can process claims and receive benefits. The one that everyone here is probably used in the past is bulk bill, and that's the majority of the claims. About 86% of all claims to Medicare are bulk bill. So if you go see a provider, you don't pay anything, they just say they bulk bill, what that means is that you are assigning your benefit from Medicare to that service provider. And in exchange, it means that service provider has agreed to accept the Medicare benefit schedule rate and charge nothing more for it. It means all the benefits going direct to the provider. So there are some limitations on it. It means that you can't charge the patient anything out of pocket above what the MBS rate is. The other program that has been growing, and it's been talked about by a number of the politicians, is patient claims. So patient claim means that instead of the benefit going to a provider, it's going to you as a patient or a claimant. Now the benefit for a provider is that you can charge essentially anything. So even though the session for physiotherapy services might be rebated at $53, if you want to charge $100 for it, that's your prerogative, and that $53 benefit will actually go to the patient. Of course, that will result in an out-of-pocket to the patient. I think there's also a lot of misconception around the percentage of allied healthcare claims that are bulk billed. And we ran the numbers pretty recently, and it's sitting at about 65%. Okay, so how do you actually lodge a Medicare claim? There's 4 main channels to do it, plus 1 manual channel, which is you walk into a Medicare or Centerlink service and you hand them over the receipts. They're really trying to discourage that, and so there are 4 main ways to do it. The first one is something called PRADA. And if you're registered with Medicare Australia, you have access to it. It's free. I think it's a pretty clunky system. Doesn't integrate with any practice management solution. It's difficult to get reconciliation reports, but it works sometimes. The other one is EasyClaim, and that was a service I helped roll out years ago. And that basically works on a terminal. It means that your patient has a Medicare card. You type in the Medicare code on the terminal, you swipe the card, and you can run it as bulk bill or a patient claim. The advantage to it is that you can apply a rebate to the patient instantly, but only if they have an FPAS card. So one of those where you hit check or save on it, and you can apply it back into the account. And that's worked pretty well up until recently, and Medicare has really started to shift it because it only handled a limited number of claiming scenarios. And the most common one, which is bulk bill, it doesn't actually produce any reports, and it doesn't tell you as a provider how much you're going to get paid every day. It just kind of went into a black box. So the two other ones that are a bit more mature is Eclipse. Eclipse is a system that's mainly used by hospitals. The advantage to it is that it can run almost any Medicare scenario. You can also do split payments. So if a patient is in hospital and they have private health insurance, it'll split the payment. So that 75% of the payments coming from Medicare, the other 25% or more is coming from the private health insurer. That said, it's a bit more complex, and there's only 20 different systems that are integrated with it today. We will shortly be one of those, but as an allied healthcare provider, there's really not much reason to use it. But the most popular one is called Medicare Online, and that's what we do well, and soon with Cliniko. So it integrates with the practice management system. It allows you to lodge bulk bill and patient claims. And the other nice thing is that it gives you back all the reconciliation reports. So it'll tell you how much you're going to get paid, if there's any exceptions to a transaction, which is fantastic. There are a couple of things it doesn't do. It doesn't do the hospital inpatient split claims, but it doesn't tend to be a common scenario. And the other thing it doesn't do is reciprocal health arrangements. So if you're from the UK and you're on a reciprocal health arrangement, it won't cover that. Most of those scenarios are handled by the settlement offices. So bulk bill settlement, getting paid. So if you run things as a patient claim, you're actually taking direct payment from the patient in most cases. They can pay in cash, they can pay on card, or whatever that might be, and you lodge a claim. So your payment is on that mechanism. For bulk bill, though, you're paid directly by the Department of Human Services. So about 92% of all the claims are approved in real time, and as long as they're approved in real time, you're going to be paid the next business day, and that's your objective. If there are any exceptions to it, you get a report from them. It's called a processing report, and they'll say the reasons why a payment was held up. And it's a little over 7% that are held up, and there's a little secret. If you just call Medicare, they release the payment immediately. They have 70 million caught up in a backlog. They don't have time to review it, so you just call and they release it. So that's a bit about how Medicare works with Cliniko. We have a great, beautiful experience coming very soon. It's integrated, it's electronic, it's real time, and it gives you transparency back as a provider, so it lets you know if there's any issues. Same thing around the patient side, so if there's been any changes to the patient, so even if their Medicare card is old and they have new details, we actually retrieve all those new details and say, here's a new Medicare card number, here's a new patient reference, and it just says, do you want to correct that stuff now? And you hit yes, it just automatically does all that stuff. We really only talked about Medicare today. So from Medipass perspective, with Medicare, we obviously do patient direct funded, private health insurance, overseas health insurance. We are actually in pilot live right now with NDIS, and we're going through certification for Department of Veteran Affairs. We should have that pretty soon. But there's a lot of other funders. There's 1,600 different funders sitting out here, so we have quite a ways to go. We got 61 funders technically connected today, and that's all I have to talk. Well, hopefully, we'll get to these in the following presentations. So thanks for your time. If you have any questions, give me a call.